Hey, I'm Brandon Williams. I'm the operations manager here at Eagle County Public Health. And I wanted to take a couple of minutes today to go over some enhancements that we've made to the Total Health Alliance issue tracker board. So this is the board where we're tracking all of the proposed projects, the status of funding, the activities of the Oversight Committee, in carrying out the implementation of the ballot initiative that we did last fall in order to enhance mental health services in Eagle County. So we've done a lot of meetings lately. Let me go ahead and share my screen. And we've done a lot of meetings lately with the Total Health Alliance. And initially it was focused on getting an idea of that footprint of current services, and then moving into establishing the Oversight Committee, being able to identify the gaps. And then now we're in the phase where we're actually looking at proposed projects. So as a result, we want to make sure that you have access to all the information and have an opportunity for input. So we created this tracking board, and I'll just go through it very quickly and some of the changes that we made to it. So on the left-hand side, you'll see the THA meetings and recaps. So this is a list of upcoming meetings, but it also captures the ones that we've done, provides a short recap, the projects that were covered. It has a link to the video for each of the meetings, and then any of the associated slides or presentations that were given. So hopefully that'll give you some context as to where we came from and where we're headed. The second column, now that we have the advisory committee identified, we're going to be doing a similar thing in that column so that you can understand what the Oversight Committee is doing in terms of considering each of the projects and how they're recommending allocation of funding to the Board of County Commissioners. And then in the third column, you'll see mental health landscape. So this was really a dumping ground where we wanted to provide some resources. So one of the first exercises we went through, of course, was to identify all of the existing services that we could in the county and start to provide, a map to be able to identify what exists. And so we've got that footprint in that top card right there. And the way the cards work actually is you just double click on one of the cards and you'll see the links to any of the documents and any additional information in the description or comments. So there is where you can actually find an interactive landscape map of what the services are that are available in the county. Underneath, you'll see last month's mental health status update. We'll be doing another one in the lead up to the next session, just to kind of sit down with myself and Chris Lindley, who's the director here at Public Health, to kind of give a status update on where we are. And then underneath that, we also run a email group. It's a Google group that we use to provide updates, announcements, access to presentations or information regarding upcoming meetings, agendas, that kind of thing. If you're interested in joining that, open up that card. There are instructions on how to join the Google group, and you'll be able to stay up to date on what's coming through email. The next column, and these next two columns are where we've spent a lot of the work recently based upon some of the proposals. When we identified what the landscape was, obviously the next step was to look at the gaps that exist in the county. And we were able, through the Total Health Alliance and a lot of the discussions we've had with commissioners and others, to kind of rank order what we believe the gaps are, where we should be focusing attention. And so we made a very clear color-coded kind of hierarchy of the gaps. And so all of them are listed, and you'll see it in order of impact. Red, orange, yellow, green indicates something that's currently present in the county. And so you can see what the hierarchy is. Obviously, we'd love your input on anything that either is not included or just anything you think about the individual gaps themselves. In the next column, over the last couple of meetings, both in the April meeting and the May meeting, we've been primarily focused on having presentations from a lot of the proposed projects that are seeking funding from the Oversight Committee. And so we've set up a form process where anybody who's interested in proposing a project can fill out a guided form. The form is directly linked to this Trello board. So as you fill out the information, when you hit submit, it's automatically added into the Trello board. But more importantly, what we've done is we've gone through a crosswalk of the gaps and the proposed projects to start to take that first step to help prioritize some of the projects. This certainly doesn't indicate which ones will receive funding. What it is intended to do is to help us look at how we're going to maximize the funds available for the maximum impact. So you can take a look at the proposed projects. Obviously, this is the source of information that the THA and the Oversight Committee are going to be heavily focused on. And this just gives a context for that. If you double click on these, you'll see in the description box actually the results of the forms that were submitted, and then any associated documents that were included in that submission. Then the next column is funded projects. Looking over the horizon, what we're hoping to do is to take those projects that are moving from proposed or approved by the Oversight Committee and recommended to the county commissioners. The funded projects is where we would actually make implementation or status updates regarding how those projects are going, what they're accomplishing, the metrics, etc. So we wanted to make this a one-stop that is a continually evolving board, so that we're constantly receiving projects and trying to put those dollars to use to make things better. The last column is ideas. Ideas is really kind of a free-form column. It's the things that come up during our hallway conversations or in meetings, and as we come across those, we try and capture them and then turn those into proposed projects. So thanks for sticking with me. That's a quick overview. Obviously, any input that you've got, we'd love to hear it. And I'll go ahead and stop the screen share. And yeah, so thanks for taking the time. Like I said, we'd love to have your comments and opinions and participation. We'd love to see you at the meetings, and you know, we're better with more minds at this. So thanks. Have a good one.